Good afternoon, everyone. Welcome to the Westport Board of Health, October 16th, 2023 meeting, which I'm calling to order. Under Mass General Law, Chapter 30A, Section 20F, this meeting is being recorded. And please join me in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Okay, we're going to try and move right along to the director's written report. Any questions from the board? I'm going to let Matt probably do some of the updates that are down below, just so we have that on the tape. So we'll turn right to the updated from Matt.
Okay, so we were gonna hold a rabies clinic, in October, it got postponed, then November, but due to scheduling conflicts, we're looking at a March, April timeframe, 2024 to hold that rabies clinic. Food clinics, the public health nurse has food clinics scheduled as follows. At the time of this report, there was one on 10/12 at Village Way, and then one coming up on November 3rd at the COA. Since I wrote this report, we had about 115 flu shots, but I think now we're up to about 125 that have been given out.
Great.
Blood drives are scheduled as follows: November 2nd, 2023, January 18th, 2024, February 15th, 2024, March 14th, 2024, April 18th, 24, May 16th, 24, and June 13th, 2024. All blood drives will be held 9 a.m. to 3 p.m. at St. John the Baptist Church, 945 Main Road in Westport, and registration is required at www.redcrossblood.org.
Okay, thank you. Okay.
And just as a reminder, next week I'll be at a conference, Tuesday on.
Okay, she'll be out of the office. All righty, thank you. Let's move to the director-approved plans. We have one.
Yep. Hold on, I'm just gonna get to that. Okay, we have a 3-bedroom repair on a 23,340 square foot lot for a David Larson at 239 Howland Road, utilizing a quick 4. And this one is replacing a cesspool, and this one's gonna require a 3-bedroom deed restriction.
Okay, any questions?
No.
If not,
So I move that we endorse the director-approved plan for 239 Howland Road with a 3-bedroom deed restriction.
Second.
all in favor? Aye, that's unanimous. Thank you. Okay. Moving on to the minutes of the last meeting, October 2nd. Questions or edits?
I didn't have any edits, did you, Phil?
No.
On the minutes, okay, so then I move that we approve the minutes for October 2nd, 2023.
Second.
Motion made and seconded to approve the minutes of October 2nd, 2023. All in favor?
Aye.
And you were abstaining because
I am
you were not-
abstaining
you were
because
not
I was
here.
not here. And thank you, Phil, for ably helming that meeting. I appreciate that. Okay, moving on to other business. I just want to announce that the next meeting was normally would be held on October 30th at 4 o'clock, has been moved to Wednesday, November 1st, 2023 at 10 a.m. It'll be here in this room as well. So just please note that if you're a regular visitor to our meeting, which we don't have too many.
I might ask, Val, is that going to be an issue for you?
Well,
Will you be able to be at a meeting at, it's 10 a.m.?
Wednesday, November 1st at 10 a.m. Okay, so we think it'll be tape recorded, if not videoed. Okay, moving on to the second agenda item, which is about unused old punch cards, and I'm going to turn that over to Matt for a presentation.
So we have been seeing quite a few of old punch cards come in, some that are 9 and 10 years old, $2 punches, $3 punches. And I just wanted to ask the board, it's kind of a bit of a work for us to take those in and credit people for the new prices. They're so old. Do we want to continue to still take them? I wanted to ask the board how they felt about it and what their thoughts were.
Open up for discussion.
So how big a problem is it?
So, and it's just time consuming to try to figure out, what's what, sometimes it doesn't work out exactly even, so people have to pay more, or you kind of fall into this kind of area where they lose a punch or something like that. So it's just, they're very old. I don't know, some people still have them, I guess.
So you count up the number of punches, so what are you doing? You're counting up the number of punches and then crediting them towards the cost of
A new card.
a new card? Oh. Mhm.
So somebody comes in with a card that has $3 punches on it, and they have 5 left on the card, that's $15. And if they wanted to buy a $20 card, then they'd have to put in $5.
So one thing that would strike me as sort of an accounting nightmare, because we track by like how many punch cards we sell at the $20 or $25, whatever the new ones are. I'm out of date in my pricing, which I discovered when I went to the transfer station. I had a check for the wrong one, so I had to redo it. Or the $45 ones. I mean, I'm just thinking that there should be some expiration limit on, holding old cards. So if you have old cards, turn them in like in the next 2 or 3 months, and we'll give you the credit, and then we just have the new card. So it's easier to track for us and for accounting, and just budget-wise.
I like that idea. Having a time limit, would we then push that to, from now on, they have to use the card within a certain amount of time? Should that be on the cards?
I think that's something that we should
Yeah,
think
if
about.
we have the new cards printed, we would maybe put an expiration date. I don't know exactly
Yeah.
what we would do yet, but we talked about it a little bit upstairs, and might be something we should do.
Yeah.
Yeah, so, I mean, I agree, setting a time limit and then, putting out some sort of, notice about it.
Right.
I think the other way to maybe simplify it would be just to establish either like, here's, I don't know if $2 is more, but just essentially outdated cards, we're gonna give you a X amount of credit, rather than having to count up all the punches and figure that is also might simplify it. So, but I don't feel strongly about that idea, but if just people, you don't turn them in, they're no good. If you come in and, be like $5 credit for an expired, card over an expired card, so.
Maybe we could implement that with the new, the next round of cards where there's an expiration date, and, you can get a credit 6 months after, up to
Right.
6 months after for $5 or $10
Right.
or something like that.
That's fine, yeah.
So it sounds like we are converging on do an outreach saying, if you have old punch cards, you have until December 31st, the end of the year, to submit them, to get a
Full credit.
credit for the remaining value. And And then going forward, we will, have expiration dates on cards so that we don't end up with this accounting nightmare going forward.
Mhm.
Something to that effect. Is that,
Yes, that sounds good to me.
okay,
Do you want to put a sign up at the landfill outlining that policy so as people driving, they can see it and be warned of it, so when they get to the girls, you just have to go through the whole process with them?
Yeah,
Yeah.
we'll put it on the blinking sign, the big light up sign, we'll
yeah,
post
that's a
something
good
too.
idea, thank you.
Yeah,
Um,
yeah, that's a good idea.
in between when
Okay.
we're closed, I imagine we can do that announcement next time, but I don't know when Veterans Day falls this year, but it might be on a day that the
It's a
transfer,
Saturday.
it's a Saturday, so
Yeah.
the transfer station will be closed on that Saturday, so that's something, maybe if we we could do a health notes column and whatever, on the webpage
Yeah.
and
You
include
can
that
put something on
information.
bulletin boards.
Yeah, include that information too. Okay. All right. So we will, do we need to do, Matt, do we need to do a motion? Okay, I move that we set a policy to accept one-time old punch cards through December 31st, 2023 for full credit. And then going forward, there will be an expiration date and a nominal refund value to simplify accounting, and that we'll do outreach around that.
Second.
Motion made and seconded. All in favor?
Aye.
Aye, that's unanimous. Okay. So till expire 12/31.
So is this gonna be like older than 2 years? Did you have an idea? That would be for 22?
Well,
Do you
this
do it by
is,
fiscal year? How do you do it?
Yeah, so the new cards, we start selling stickers for the next fiscal year, May 1st.
Yeah,
So
but it's different than punch cards, right?
that's punch cards.
Oh, punch cards, okay,
Yeah,
okay, so,
well, punch cards we sell all year round, right?
we start to sell stickers May 1st
Right,
for the new year, and punch cards we sell year.
right.
yeah.
But if we are changing the price, I don't know, based on our budgetary constraints, we may be revisiting the fees, and so we'll,
Right,
the next time we do new punch cards, whenever we raise the
Right.
fee.
Well, I have from
Okay,
now
we'll figure it
till,
out.
I have from now till December 31st to set a policy, so I'll write one, and we'll talk about it and tweak it as needed, and if we have to come back to the
Okay.
meeting, we will.
Okay, all right, that's a good, better strategy.
I was just saying, there's a difference between coming in with a $2 punch card that they bought in, I don't know, 1990,
Yeah.
and, a punch card that they bought in, I don't know, 2022, or something,
Yeah.
so we need to think about, just because.
Well,
So anyway,
I think this will be sort of a one-time amnesty,
Yeah.
clean up anything,
Yeah,
you
right,
have in
right.
your
right.
drawer from
Use it,
10 years
yeah,
ago,
yeah.
and then going forward, we'll have a
Right,
more
so they can come in
streamlined.
and get the credit, so that would, which is whatever it is, yeah, that's good.
Or they could just donate it to the cause, because
Yeah, that's
every
right,
penny.
right.
Okay, thank you. Next agenda item, a discussion of 25 to 27 Mount Pleasant Street basement unit was deemed unfit for human habitation. I'm going to turn that over to Matt for presentation.
Yeah, so we had to deem another property, part of another property unfit for human habitation because of the living conditions. So we did that without coming to the board, which we can do per the housing code, but now we have to come to the board and get there to endorse it. And basically, the situation surrounding this case was an unfinished basement with no bathroom or potable water. Somebody was living in it. It was it wasn't habitable for human habitation, so we had to move quickly to, get that situation rectified and move those people to a different spot to remedy the situation.
So the issue has been resolved for now in terms of nobody's living there and it can't be used for human habitation. The owners know that.
They do.
Okay.
The owner lives there on the first floor, so we talked to the owner and got that tenant some, involved some resources to try to help them out, so.
Okay. So I would take a motion, any other questions from the board? So I'd take a motion to ratify the director's determination of unfit for human habitation for 2527 Mount Pleasant Street, basement unit.
So moved.
Second?
Motion made and seconded to endorse that determination. All in favor? Aye, that's unanimous. Thank you. Okay, we have some time for board member updates. With my left first.
Oh, well, I don't really have that much to report out. The thing I've been working on, which is somewhat involves the, members of the board, is in my role as chair of the health committee for the climate resiliency committee, and the Commonwealth has just issued a new report, a statewide report on climate resiliency, kind of doing the analysis, the risk analysis part of it, and also what measures communities can consider taking for purposes of planning. They seem to have a very robust public outreach process to do it, and so I don't have the web site for it. I didn't bring that because I wasn't really thinking about it that way. But what's interesting about it is that so for the Buzzards Bay area, they consider, and we talked about this last time a little bit, the increased likelihood of diseases being transmitted by ticks and mosquitoes is actually the highest risk for this area, higher than temperature increases, which I think are not necessarily confined, but more significant in urban areas in terms of the temperature risk. So that's what I've been kind of reading that report and comparing it to the other information that we had collected, and kind of preparing the health report for the CRC.
Okay. Well, thank you for staying on top of that. Interesting finding. Well, we did have that West Nile virus case.
Right.
In the fall, and I know that they say the season is longer because we haven't had, killing frost later in the year and so on. Certainly this year with the degree of rain, I'm sure it was a higher risk year, although...
I'm a walking advertisement since I just recovered from Lyme disease and other viruses that are associated with ticks.
Oh, yeah.
So.
Okay. Well, I'm glad you've recovered.
Yeah, thank you.
But
Me too.
It can be, it's like, long COVID. There can be long.
Yeah.
I don't want to say it, but
Particularly this other thing could have been dangerous. But.
Yeah. Okay. Thank you. Do you have any update on the septic tax credit?
I think we're still waiting for the governor's approval of the total package.
Okay.
And then I thought we could then put something, into Shorelines.
Absolutely.
And talk about it, and because I think it is, there are a lot of savings potential there, because you can, depending on the price of your, the cost of your system, but you can recover $18,000, a maximum of $18,000 over a period of 6 years, which is a pretty big, directly off your taxes, which is a pretty big bite of, out of the cost of a system.
Yeah. No,
And-
a big help.
Yeah, And
Especially all those cesspools.
if you have a long-term loan, you could really, kind of zero out a lot of your interest payments,
Mhm.
in that regard. So, and I don't see why it would not be approved by the governor, but, yeah.
Okay, great.
So we can write up the details of that and,
Yeah, I think if we
yeah.
be
Yeah.
prepared to get that word out as soon as possible, that would be helpful.
Yeah.
Great, thank you. Okay, Donna.
I don't really have anything to report other than I just spoke with Gabby, and then I want to speak with Olive about really thinking about May of next year, or whether or not we're going to do some kind of a health, other than the Mental Health Awareness Month, if we were planning any other health education opportunities in the consortium, the collaborative of the towns. So I want to talk to Olive about some of my ideas and hers and see what we can come up with for that.
Mhm.
I don't know if there's been any other movement towards doing a wellness event, a larger scale wellness event or not.
There is, we're working on it now, just starting to work on it, but we're thinking April to do one. Maybe the end of March, but in that time frame, we're in the early workings of it, but,
Later April would be better for me to participate.
Okay.
Because I'm planning a little trip the end of March, the beginning of April, so. But,
Okay.
but I certainly I'm sort of anticipating getting things ready and looking at topics that would benefit the collaborative that we have, so that, to look at what the needs are in each town, to really address that. And since Olive is out there, she can talk with each Board of Health about what their particular concerns or issues are regarding public health. So.
right, so she started she sent out an email today to meet individually with each community and kind of flush all this type of stuff out, see what their needs are, what their concerns are. I mean, it could be a situation too where we integrate this health and wellness event into May in some way. It's part of Mental Health Awareness Month, and kind of address a lot of those topics at the same time.
Okay.
So we can talk about it further, It's
Yeah,
a little
maybe
while to
send
go.
me Olive's email and then I can communicate with her that way.
Sure.
Because I don't know what day she's here.
She's here on Monday, Wednesdays, and then you can get her by email the rest of the week.
Yeah, so let me just do the email with her.
One of the things that she did and showed me was, the community profile. We now have it on our website, but that comes from DPH. Just all the demographics and, overdoses and age and all those kinds of things. And she did a side-by-side comparison of the 6 communities in the collaborative to see, it's interesting, language proficiency or income and so on, and where which towns have the highest percentage population of older adults and so on. So it's an interesting thing. So she's definitely digging deep already and gathering information, and I know she's.
Is that up on the website?
The 6-town
Yeah.
comparison, no, but
Are
just
we-
Westport's is on.
Westport's on, okay.
On
yeah,
our
yeah,
website.
'cause I looked at that a little while ago, just related to the health
Right.
piece of it. And, yeah, DPH does keep track of that. And I'm just wondering whether they project forward or not.
Not that I know of. It's
Yeah,
just
see, that would be
retro.
really helpful,
Yeah,
for purposes of planning, for example.
for climate
And
resilience.
or maybe there is a formula, or there's some people will, I'm sure that someone has thought about that and figured out how you would go about doing that in a legitimate way. It's like,
There are experts who do.
you know what I mean?
Yeah,
It's because they figure out, well, how many people are going to collect Social Security and blah, blah,
Yeah.
blah, and they figure these things out, so that would be that kind of, so to know in 2030, how many people would be 65 or however you want to break out the age categories, just in terms of anticipating, different demographic needs.
I will say that, so we're building, in the process of, we hired a company to build the collaborative webpage. So we're hoping that's gonna be up and running maybe November, December. And it'll have that side-by-side comparison and a lot of interesting data and stuff on it concerning the collaborative. So
Yeah.
hoping to get that up and going in the next month or two.
Did you
Right.
hire somebody already?
Hire somebody, yes.
Okay.
Yeah, I know, and Olive, given her background in harm reduction and, the whole opioid issue, she's working on that element of her expertise to develop materials for the group as well, so lots going on there. She's been a great addition. Okay, from me, just briefly, I'm, as you know, I was appointed to the short-term rentals committee, developing regulations around that. I missed the last meeting because I was away, and the next one is this Thursday afternoon at 3 o'clock. I know they got a lot of public feedback at the last one, or at least that's what I saw in the newspaper. So I'll have more to share once I'm actually at the next meeting. And of course, our role is in terms of the public health component of short-term rentals, should they proceed with developing a mechanism to allow them in town, really around the septic and drinking water are sort of our public, our particular interests. Okay, we have, just make sure, we have scheduled our public hearing at 4:30, which is in about 3 minutes, so I don't want to.
Can you to get some COVID numbers?
Yes, do you mind?
I'm sorry?
You want some COVID?
Oh, yeah, go ahead.
So, the COVID numbers, they're not accurate, because they're not reporting through the state, but, in the last, 30 days, there was, 16 cases being reported, and no deaths that we know of, or hospitalizations that we know of that are being reported.
Thank you.
We are, actually I discussed, thank you for bringing that up, because that reminds me, I had talked with Matt that maybe, we stopped doing our COVID updates, written reports a long time ago, but maybe we would do once a quarter, or once a year, something, because the new vaccines are available, they're not doing COVID cards anymore. There's, miscellaneous information that people may not be aware of. So we're planning on doing a fall COVID, update, and we'll share the latest information that we have around all of, vaccines, where you can get tests, kits, and all that kind of stuff. So look forward in the next couple weeks. Okay, do we have any other topics for the next regular meeting we want to, anyone has anything to put on the agenda at this point? Or anything unanticipated? Otherwise, we can move, I think, to the hearing, which will begin. Any second. Anything else?
No, that's good.
Okay. Then it being 4:30, I'm going to open the public hearing about the Westport Local Septic Regulation Proposed Amendment. We'll go through that briefly. We have extra copies if anybody's interested, who's present. I can put those out there. And I will just go through a brief discussion of what's basically the main proposed change. Most substantive one is to extend the deadline for requirements to upgrade cesspools. Again, the earliest of 3 possible times. It's been declared in failure, then Title V establishes a timeline, and typically 2 years, maybe shorter. If sewer becomes available, then you would be required, and Currently, the regulation requires all cesspools to be upgraded by February 1, 2026, and we're proposing a 2-year extension to February 1, 2028. And that allows more time. The town is in the process of seeking funding for sewer along Route 6. So there was a lot of question about people who have cesspools there to have to upgrade before we know the status of the sewer, and giving more people a little bit more time to, figure out their options. So that's the primary change. That would be in section 9.0A3, changing the date, and giving it 2 more years from February 26th, 2026 to February 2028. There are also a couple of other very minor changes, wording changes, which are clarifications that I'll review. The other ones are in section 5, which is the building renovation regulation. Again, this is one that was incorporated into this reg based on an existing town reg that's been in place for 20 years. The provision under section D, which says any building uninhabited for 3 years or more requiring an upgrade to a septic system that's not approved under Title V will be considered as new construction. We are proposing to add the words under Title V to make it clear it's not new construction that requires a D-Night system. It's just uninhabited buildings have to, when they upgrade their septic system, have to meet the new construction, permitting and so on requirements. And the rest of the sentence goes on, and will require all percolation tests, permits, fees, and plans necessary at the time of application. So that's just a clarification that we don't intend to expand or include the new construction requirement for D-Night to this particular circumstance of uninhabited buildings. So that's just a clarification there. And I think we had one more. Clarification, this is under section 16, on monitoring for innovative alternative septic systems. This is under section A, where we require semi-annual measurement of total nitrogen in the effluent of any nitrogen-reducing system. We're proposing to add the words installed per section 10 of this regulation, which means this requirement for 2 times per year total nitrogen testing is only required for D-Night systems that are put in as a result of section 10, which is for new construction. So in other words, if people add a D-Night on a voluntary basis, or it's as part of a repair, the total nitrogen testing requirement does not apply, although people may wish to do that voluntarily just to see how well their system is working. So again, that's just a clarification to, there was confusion around when total nitrogen testing was required. So it's required per this clarification. It'll make it clearer for all new construction, increase in flow, which is considered new construction, where a D-Night system is installed. In other situations where D-Night systems are installed, in other circumstances, the total nitrogen testing requirement would not apply, although it can be voluntary.
I think you had said it was in section 16. It's in section 12. At least that's what it is in my version.
Well,
It's in section
section 12
16A.
is the performance standards, but the actual language around total nitrogen testing requirement is in section 16 on page 10. Do you have yours?
We're missing 9, that's why.
12A. So it must be the way
Oh,
we
no,
put.
it's backwards. I
Because
see.
you're missing a page.
Is I'm missing a page.
Or it's, or
Oh,
you-
well,
or
take
it's-
one of
or
these
it's-
copies.
Yeah,
It was
okay.
copied in,
Yeah, I think that it was just not
Yeah.
put together correctly, because
Yeah,
mine
it
is the
was
same
copied
way,
in
Matt.
backwards there.
I didn't do it.
Okay, so I will open the floor to if there are any comments on these proposed changes to the regulations. And we haven't received any written comments. This was a public hearing that was in the paper, publicly announced, so. Seeing no objections, I think we can move to, because this is such a minor change, we can vote to accept these proposed amendments and choose an effective date, which could be today. That gives people, notice,
Mhm.
as much notice as
Do we want
possible of that extension, which is the most significant change.
Would we want to pick a date before we approve?
Um,
Or the effective
Yes,
date?
yeah, either today, effective October 16th, or we can do it November 1st, or some other date if you wish.
What do you think, Matt?
No, I think probably if people are aware, well, let's see. When would we be, because we would probably be putting out notice of it, next week, right? So we should probably do it sometime this week so that then we could publish it next, like in the Shorelines, or make an announcement about it, just because.
How about we just
I
say
don't know if people are
Why don't we
making,
just say
it would
today?
affect people's,
October 16th, 2023?
yeah.
So that would just mean the effective date. The revisions to this regulation will take effect on October 16th, 2023. So I would accept a motion to adopt these amendments to the regulation, the Westport Local Septic System Regulation, as described in the hearing.
So moved.
Second.
Motion made and seconded to adopt those changes, primarily the extending the cesspool deadline for 2 additional years. All in favor?
Aye.
Aye, that's unanimous, thank you. That was good. Okay, we are close enough, I think.
I have
Oh,
a
no,
question before we
Sure.
move on to the appointment. Do we have a plan for Shoreline's article for next month?
Well, we were talking about the punch cards.
Hopefully I'll be able to do something about the tax
The
credit.
tax credit.
So it can be a
But-
hodgepodge of whatever.
Well, I think Shorelines might be willing to publish more frequently than monthly if we have more news to share. I'm not sure I want to mix,
Right.
punch cards and tax. I think they're standing on their own.
Well,
Um,
the other thing that I didn't include in my update, but which I am, working on, is I was trying to get more details about what the mass housing septic loan, not credit, but the septic loan provisions were, and so I've been speaking to the bank representatives about that, and we are trying to arrange a follow-up meeting. But for people within certain income limits, you can get a 0% loan.
right.
And if you're in another income category, it's 2.5%. And so I was trying to get a bigger picture about that. So it could be possible to combine that information for people in something to be written up about the septic credit.
Yeah,
And
that
so-
would be great, because we also want to give them a heads up that we propose in the change to the
Yeah.
the loan program that the town of Westport specifically has, or
Right.
the Board of Health specifically has from our prior grant, which would expand eligibility based on a town meeting vote next May.
Right,
So that would,
right.
although,
But it would
yeah,
all, right, I
all
mean, if
sort
we,
of tie together.
right, so if we talked about the amendment regarding the extension,
Mhm.
the tax credit, and then some of these other
Yeah, we could combine all those. Those are all related.
Yeah,
Okay.
just to, I think, say that, we're just sensitive to the economic changes that have happened since we first adopted that may make it more challenging for, people to pay for or finance, a conversion of their system, so.
Sure, that makes
And then,
sense.
Yeah, and then maybe be some update. I'll reach out to the planning board folks and just see if there's any update on the status of the Route 6.
Sure, okay.
A suggestion I have for Shorelines is sort of like an update on what the collaborative is doing and working on, how we're working with the other communities. And I would be happy to do something with Olive as well. Anything about if we're working on the event next year to do one, but I can do Shorelines either November or December, so.
That would be great. I think the punch cards one doesn't have to be necessarily health notes. Maybe we can just do like a short, sweet one. Then do the tax credit regulation update next, and then the collaborative update, because we do have, the staff added now and so on, so that would be something that we can look to November, December. That'd be great.
Yeah, and the reason for that is I'd like the town to appreciate how this grant is benefiting the town and our connection with other communities. So, and especially if we get the data, if Olive gets the data all together about the comparisons and everything, I think it's a very helpful information. Where's Westport standing compared to our communities that we're working with? So,
Yeah, and by November, December, the collaborative website might be up with some of those resources and stuff on
Yeah, so we
it
can
and so
direct
on.
people
And
to
we'll
that.
link to from our website, and I think she's being significantly younger than me. She's much more tech savvy, and so there's a lot more communication channels that she plans to take advantage of to get word out. So that'll be great. Okay, so if you want to take the lead on that one for November, December, that'd be great.
I'll talk with Olive and see what.
Phil, you and I maybe can do the combo, or you can take the start lead and anything on that, and I'll do the punch cards, the glamorous punch card, amnesty. Okay. I think we are close enough to get started on the 445 variance hearing. Zenith Engineers for 62D Drive, Jennifer Conway, trustee. This is a 3-bedroom repair with a Presby on a 26,880 square foot lot. We have somebody from Zenith here, I'm guessing. I forgot to mention the language. It's a draft still. Good afternoon. Introduce yourself.
For the record, Niles Zager from Zenith Consulting Engineers. So we're here before you with a septic upgrade for a 3-bedroom home. Currently, it's serviced by a private well, and all the abutting properties is serviced by private wells as well. Septic system is in the rear of the property. We were able to luckily get over 100 feet with all the wells either on site and or abutting. We are proposing a Presby septic system. In doing so, we are asking for a reduction in the separation of water table from 4 feet to 3 feet. Presby under their remedial of 4 to 2. We typically don't like to go to that. So we're asking for 4 to 3. And then we are also asking for a reduction in the inlet and outlet of the septic tank and pump chamber, separation of water table from 12 inches to 1 inch. We're proposing H20 monolithic septic tanks, which keep them as watertight as possible. There's also for buoyancy. And we're proposing rubber boots at the inlet and outlet for water tightness as well. All the tank covers are going to be gasketed for water tightness, so that's always one of the biggest concerns when you're on sites like this. So that's why we're here before you. I'd be happy to answer any questions that the board has.
Okay, great. Let me turn first to Matt, and then we'll open up to the board. Any other questions?
As far as the design goes, everything looked great. It's just, is there a way to put the property owner's name on the piece over here? You just have, Tri-Spec as the client, but the homeowner's name isn't on here anywhere.
Okay.
If you could squeeze that into somewhere over here and then just kind of resubmit those, that'd be great.
That's not a problem.
And along those lines, I was looking at the buoyancy calculations, and it's just a typo, I realized after I figured it out. But for the septic tank, you have the buoyant force 23,537 is greater than 23,537, which it's not, it's equal. But that's because the buoyant force was really 22,357. So it's just
It's a typo.
a typo. But otherwise, I like the detail that you put on the plan. It was very comprehensive, and great job.
It's a great catch, so thank you for that. And I will absolutely update that when I update the information.
Okay, any other questions or concerns?
Nope.
Okay, then I'll ask one of my fellow board members to do a motion. It's been reviewed through Concom, so we just need the usual.
I have a question.
Oh, sure.
Because of the size of the lot, do we need water testing? Because it's a small.
The wells are all over 100 feet away,
Okay.
so, no.
All right. All right, so I move that we approve the plan for 62 D Drive, owned by Jennifer Conway, trustee, dated 9/28/23, for a 3-bedroom repair with the following variances: a reduction of the separation between the inlet and outlet tees and the high groundwater table, and the reduction in depth to groundwater per modified certification remedial use for Presby Environmental Septic from 4 feet to 3.1 feet. Oh, with the following conditions: 3-bedroom deed restriction and a hold harmless agreement.
And that corrected
Oh,
plan.
I do.
No, he's just.
Now in the correction, the amended
Yeah, just-
corrections to the plan.
Second.
Motion made and seconded. All in favor?
Aye.
Aye. That's unanimous. Thank you very much.
Have a great night.
You too. Okay, we are,
The what? They had a dollar punch on them.
I will just, we have a few minutes. We have to wait for the next hearing. Although, were there any abutter notifications required for this one? No. So could we do it a little early?
Sure.
Okay. Then I'm happy to call this one early. This is a variance hearing that was continued from October 2nd. George Ayub representing Sandra D. Coleman at 36 First Street. This is a 2-bedroom repair with a Presby and a Singulaire on a 75,447 square foot lot. Mr. Ayub.
Good afternoon.
Good afternoon.
For the record, my name is George Ayub. I'm representing Sandra B. Coleman at 36 First Street. Currently, there is an existing house. It has 2 bedrooms. It's being serviced by 2 cesspools. Unfortunately, a lot of wetlands on this lot to the south and to the west. The only location where we could put a septic system, I'm proposing a new septic system. I'm clearing all the wells, adjacent wells, except I cannot clear the subject well. I moved as far as I can, otherwise I'll be in a wetland. And I'm increasing from 83 feet to roughly 87 feet the distance. This is the only variance I'm asking from the Board of Health. I'm using the single layer type, the total denitrification system, and I'm using the Fresky system. We're not asking for any reduction in the groundwater. Basically, I'm going 4 feet. That area been, the house has been constructed a while back in 1954, and in the 60s, most of this area has been filled in, my entire street and over there. And I know we had hearing with conservation, Mr. Weinberg mentioned the velocity zone over there.
Right.
I did check it out and I sent Matt the information. Anything before 1995, March 1995, I'm exempt from the velocity. This is a state law.
Right, yeah, I think the outcome is right, and and I think that at the Conservation Commission, I think that we didn't have a consensus about whether or not it was in the V zone. So I think it is in the V zone, and I also agree that under our regulation, because it's a system that exists as of March 1995, we can, and there's, and the house is not being elevated, that you can, that this is consistent with our regulations. And I think the title, anyway, yeah. And you're not in a resource area that is covered by the Title V regulations, because you're not in a barrier beach or a dune or, so that's one difference between, our regulation is more expansive in its coverage, because we don't make the resource area that you're in a condition of the rules. It's whether you're gonna have flooding on your property is what we're looking at. So I think it's, so I think we're okay.
Okay.
And Chris stamped, gave his approval of it.
Okay.
So I think we're okay.
Okay, I'm going to turn next to Matt for his report.
Sorry, I didn't.
No, that's okay. It was
Okay, yeah.
No, I mean, given all that information and we researched it before the meeting, everything's good. Or everything to add?
Yeah, I just make note of the water testing, the level of nitrate and the fact that coliform is present, but he's putting in the D-nite system, so.
right. Well, that does lead me to just ask a clarifying question, because when I looked at the IA approvals, I could not find one that said TNT 600DN. There is a TNT 600 remedial approval. I'm assuming that's the one you mean.
I'm using the DN with total treatment. I'm using another unit in front of it. It's just 24-inch total treatment.
Okay.
It is shown on the plan, by the way. It's right, this is the unit right here. This is an extra unit in front of it.
An
right
extra
here,
unit.
24-inch.
Okay, so it's a,
This is the best one they have, matter of fact. I talked to Matt Dalton, this is the best one they have.
okay,
The other one without this one, it doesn't have it. I'm using this DN unit.
okay.
It's right here, 24-inch wide.
So can you clarify which approvals, so you're doing, because you're doing 2 units?
No, I'm doing one unit, which
Okay.
is single layer unit DN 600. And this unit has a recirculating pump in front of it. Based on the results, they could change the timing for the pump to send the effluent back to the tank and treat it more.
Okay. Can you just provide which approval number you're operating under for this install?
I have it, I think.
Yeah, if you have it, that'd be great. I just
think have
just
it.
wanted to
I
understand.
prepared all the papers.
Is it on the,
It's not on the plan. Not
is
that
it
I-
on the plan? Where did it say?
Uh,
Maybe it was the other.
I didn't see it on the plan, so, the approval number, that's why I'm asking, but I may have missed it. If you don't have it handy dandy, that's okay, just email Matt.
Yeah, I will send it to him, but this is the only one I have there. She already signed it.
Oh, okay.
She already signed it.
So it's,
You want the X number? right?
yeah, so it's the 600 DN, not the TNT.
It is at the end.
DN, but not the, because you had it listed as a TNT?
This is, I copied basically their
Okay.
brochure, and they added the DN in front of it.
Okay.
At one time, I used it without the DN, without that unit, and Matt told me you gotta use it, and I started using it from now on.
Okay, yeah, if you can just give us the approval number that you're
I will
operating
do
under, that would be
I think
helpful.
I think I gave it to
And,
I sent it to
Nancy?
Nancy, I think so, yeah.
okay, so I would just suggest, I mean, obviously, we have some conditions, the standard ones. Just based on our regulation right now, we just said, we don't require total nitrogen testing, by default, by the regulation. I would ask the board to consider requiring 2 times per year total nitrogen testing in this circumstance because of the high nitrates already in the well, the proximity to wetlands and to the let. It's a very sensitive area. So, which would mean the O&M operator would have to add that to their contract. Although they've already signed it, maybe they can sign an amendment, or maybe it's in the contract. I didn't look closely. It would not be required under our newly adopted regulation amendment, but I would encourage the board to consider that. So that's my comment on that.
Can I say something?
Yes?
The owner already signed an agreement with the singular type, and they're going to test it.
They're going to,
And they
okay.
sent it to Nancy already.
Okay,
They sent the
then
papers.
if it's
the
already,
agreement to Nancy.
yeah, the two,
Unfortunately, I don't have it here, I have it in another book.
that's okay.
You can
Um,
still state it, though, in
So
the
it's
in
already,
the conditions.
they're already in compliance with that. Okay, any other questions or concerns?
No?
Oh, we can also require water testing. because-
Yes, it would, 3 years of water testing, yeah. 2-bedroom deed restriction, hold harmless, and the LUA.
And testing for 3 years also, too.
Yes. All right.
2 years now?
Testing.
Oh, the water testing, sorry,
3
water
years.
testing is 3
3
years.
years,
Three
yeah.
years.
The total nitrogen testing is 3 years.
Okay.
All right, I'll take a stab at it. I move that we approve the plan for 36 First Street, owned by Sandra D. Coleman, dated September 7th, 2023, for a 2-bedroom repair with requested variance of a setback from the SAS to the well of 87.4 feet, with the following conditions: hold harmless agreement, 2-bedroom deed restriction, water testing times 3 years, TNT, the board
Total nitrogen.
total nitrogen testing 2 times a year for 2 years, and an O&M agreement, which has already been signed, so.
Second.
Motion made and seconded to approve the project at 36 Fourth Street with First Street with the conditions listed. All in favor? Aye, that's unanimous.
We also need the number, right?
Yeah.
To get the,
Thanks,
to
George.
put that on the plan.
Did you mention town common in the motion?
Oh, no, you know what, I didn't.
No, because it's
But it's
stamped.
got-
It is, it has been already.
Well,
It has
I
been.
just-
So
Yeah, it was.
so we didn't include it. You may, yes, absolutely.
Wait a minute, has it been approved
Did
by
you-
Concom?
You included
Yeah.
an email from Chris, which I assume got resolved because he stamped it.
They were both approved.
Yeah, I did.
Okay,
It's, hard to read on there.
yeah, okay.
Okay, so one more quick thing before we adjourn. I shared it just now with Phil. That's actually my copy, but I can
Yeah,
read
I
it.
can see it, the notes on it.
The Buzzards Bay Coalition is developing an information flyer about installing a nitrogen-reducing septic system at your home. So it's a consumer-oriented packet with information that would be bay-wide, but it's would be something that we can share as well. That is separate from the document we're oriented towards the engineers about which technologies can be accepted and so on, that we've been working on since August, actually. But I just want to alert people to that. That will be coming out. They're still in draft form, but that'll be another information source that we hopeful that we maybe can reference in that info packet. I mean, the health notes. Okay, anything else?
I don't think so.
All right.
Okay, so I move that we adjourn this meeting at 5:01 PM.
Second.
Motion made and seconded to adjourn. All in favor?
Aye.
Aye. That's unanimous. Thank you, everyone.